Good day, this is KEIXA and I'm here to discuss what is STDs and how we can prevent it. First is let's talk about what are sexually transmitted disease or STDs. Sexually transmitted disease or sexually transmitted infections are infections that are passed from one person to another through sexual contact. They are usually spread during vaginal or oral sex, but sometimes they can spread through other sexual contact involving the penis, vagina, mouth, or anus. This is because some STDs like herpes and HIV and HPV are spread by skin-to-skin contact. Some STDs can be passed from a pregnant person to the baby, either during pregnancy or when giving birth. Other ways that STDs may be spread include during breastfeeding, through blood transfusions, and by sharing needles. So there are many types of STDs, and these include the chlamydia, genital herpes, gonorrhea, syphilis, HIV, HPV, pubic lice, and trichomoniasis. So what are the symptoms of sexually transmitted disease? STDs don't always cause symptoms or may only cause mild symptoms. So it is possible to have an infection and not know about it. And even without symptoms, STDs can still be harmful and may be passed on during sex. If there are symptoms, they could include unusual discharge from the penis or vagina, sores or warts on the genital area, painful or frequent urination, itching and redness in the genital area, blisters or sores in or around the mouth, abnormal vaginal odor, anal itching, soreness or bleeding, abdominal pain, and fever. So, how STDs can be diagnosed? If you are sexually active, you should talk to your healthcare provider about your risk for STDs and whether you need to be tested. So, this is especially important since many STDs do not usually cause symptoms, like what I said. Some STDs may be diagnosed during a physical exam or through microscopic examination of a sore or fluid swab from the vagina, penis, or anus. Blood tests can diagnose other types of STDs. So, what are the treatments for STDs? Antibiotics can treat STDs caused by bacteria or parasites, but there is no cure for STDs caused by viruses. But medicine can often help with the symptoms and lower your risk of spreading the infection. Correct usage of latex condoms greatly reduces but does not completely eliminate the risk of catching or spreading STDs. The most reliable way to avoid infection is to not have anal, vaginal, or oral sex. So how can we prevent or can STDs prevented? Vaccination. Vaccines are safe, effective, and recommended ways to prevent HPV. Second is reduce number of sex, mutual monogamy, and use condoms. That's all.